Our muscular structures. Let's move on here to speak about some of the neurovascular structures. We'll start by looking at the anterior thigh, and we'll go through each of the nerves, arteries, and veins that are encountered as we make our way down from the thigh to the foot. So the first are the femoral structures. So the femoral vessel and nerve are located in the groin region. The femoral nerve is going to innervate all of the muscles of the anterior thigh that we spoke about. So the quadriceps femoris muscle. And next to that is the femoral artery, which is also bringing blood supply to the anterior thigh. And then next to that is the femoral vein. Okay, now it's important to understand the order of these structures. So they're always in this order: the nerve, the artery, and the vein. And if we're going from medial to lateral, that'll be the vein, the artery, and the nerve. If we go a bit deeper here, we can see the branching of the deep femoral artery, also called the profunda femoris artery, which is a branching artery that comes off of the femoral artery itself, and that will go deeper into the thigh and innervate some of the deep thigh muscles that we spoke about. So we've got the femoral artery, and then branching off of that is the deep femoral artery. Now, let's look at some of the vessels on the anterior leg. We've got the superficial fibular nerve, which is actually a branch coming from the fibular nerve. And then we've got the deep fibular nerve. So the fibular nerve, when it reaches to the head of the fibula here, it's going to divide into two branches. One is the superficial fibular nerve, which goes on the lateral aspect of the leg. And then the deeper version of this nerve is the deep fibular nerve, which goes deeper into the thigh, into the leg, and innervates some of the deeper muscles. And again, here we can see that the term fibula is interchangeable with peroneal. We can also look at the vasculature in the region, so the anterior tibial artery and vein. So the vein is usually accompanying the artery, although it's not being shown here. The anterior tibial artery is a branch that's coming off of the popliteal artery posteriorly, and I'll talk about where the popliteal artery arises. But that is going to pierce this ligament, and it's going to run on the anterior aspect of the leg, and it's going to bring blood supply to some of those anterior leg muscles that we talked about. This is called the anterior tibial artery, and although it's not being shown here, it is accompanied by the anterior tibial vein. Let's look at the gluteal region, some of the neurovascular structures here. So if you flip over to the posterior aspect of the lower extremity, we start off by looking at this large nerve, the largest nerve in the body. It's called the sciatic nerve, and it begins its descent into the lower extremities by arising posterior to the piriformis muscle. So if you remember the piriformis muscle, right, that's running across the gluteal region here, it's going to be deep to the gluteal muscles that we kind of attract or cut away to expose the deeper structures. And just beneath that, we see the sciatic nerve emerge and descend into the posterior thigh. At the knee region, the sciatic nerve divides into the tibial branch, which is medial, and the common fibular or common peroneal branch, which is lateral. And then the common fibular branch is going to further divide into those two branches that I mentioned earlier. So if I go back to this slide, we can see the two branches that the common fibular divide into. Those are the superficial fibular, which goes lateral, and the deep fibular, which goes a bit deeper. So those are branches coming off of the common fibular nerve. And then going right down the middle of the posterior lower extremity, we've got the tibial nerve. So the tibial nerve continues on into the leg, and that is going to innervate some of the lower leg structures, but it's also going to divide as it makes its way down. Let's look at what happens to the femoral artery. So the femoral artery we encountered, and I'll go back here, on the anterior aspect of the thigh, but after it gives off this deep femoral branch, it's going to continue descending. It's going to go deep into the thigh. This is the anterior view, and it's going to emerge here on the posterior aspect of the knee, and it's going to be the same vessel, but it's going to change its name to become the popliteal artery. and then the vein will do the same thing and accompany it here as well. So emerging on the posterior aspect of the lower extremity here at the knee region, which is sometimes called the popliteal fossa, this diamond-shaped region that's posterior to the knee. We call these vessels here the popliteal artery and the popliteal vein. We can also see the tibial artery that's descending here and the common fibular artery that's branching into the superficial and the deep. Now let's look at what happens to the tibial artery as it descends into the lower leg. So the tibial artery will then divide into the posterior tibial artery, which continues descending on the posterior leg, and the anterior tibial artery, which pierces the leg and is going to end up on the anterior aspect. So if I go back to this slide, we already talked about the anterior tibial artery and vein. I'm sorry. Yeah, artery and vein here. Here they go. And those are what the popliteal artery will then branch into. So the popliteal artery branches into the posterior tibial artery, and posterior tibial vein is what the popliteal vein will branch into. And then we've got the tibial nerve, which continues descending here, running alongside this posterior tibial artery. Now on the lateral aspect of the leg, we've also got the fibular artery and fibular vein. So once again, the veins are not being shown here, but they're running alongside the accompanying arteries. So the lateral branch here is going to be the fibular artery, and it should be accompanied by the fibular vein. Descending here is the posterior tibial artery, should be accompanied by the posterior tibial vein. And then the branch of this artery that goes here, that penetrates this ligament and ends up on the anterior aspect, is called the anterior tibial artery, and that should be accompanied by the anterior tibial vein. And once again, these three vessels, these three branches are coming off of the popliteal artery and accompanying popliteal vein, okay? All right, so that is the end of our lower extremity discussion. And it may be a little bit difficult for you to think about, especially the neurovascular structures in a continuous or way that makes sense in terms of the branching of the arteries and the veins, the way that the veins drain together. So I encourage you to try to draw this out, okay? Try to draw out the femoral artery and in your own way, illustrate the way that it pierces the thigh and ends up on the posterior aspect and then branches into these three vessels that we spoke about here. And then draw the veins accompanying it. Also try to draw out the nerves. So think about the femoral nerve on the anterior aspect of the thigh. Think about the sciatic nerve as it branches into the tibial and common fibular, and then the further branching of the common fibular into the superficial and the deep. So try to draw these structures out as a way to really test yourselves, one, but also make sure that you have a good relational understanding of the neighborhood structures and where these vessels and nerves are in comparison to some of the muscles that we spoke about. Alrighty.